Tenet Health Analysis Project Proposal presented by Lorena Briceño. In this presentation, I will analyze Tenet Health by describing the nature of the industry to include its mission and values and its business strategies by using Miles and Snow theory and Porter's 5-4 strategy. I will also describe and explain the structural analysis, the industry dynamics, and the legal environmental factors of this Fortune 500 healthcare organization. Tenet Healthcare describes the organization as a comprehensive network that aims to uphold the highest standards when it comes to quality and safety. They have proven to be one of the leading healthcare service companies working across the system to improve service delivery and patient outcomes. Across their network of medical facilities, Tenet employees provide compassionate, quality care to millions of patients through a wide range of services, from wellness and primary care to chronic care management, urgent care, outpatient surgery, advanced diagnostics, rehabilitation, and acute hospital care. Tenet Health business strategies are concentrated around its fundamental values and ethical principles. Tenet Health's mission statement declares that at Tenet, their mission is to help people live happier, healthier lives. Therefore, Tenet's mission is to serve the patients, customers, and communities by offering a unique environment influenced through its mission and its 5 core values. So what are Tenet's 5 core values? Quality. Tenet describes quality as the core of everything they do and every decision they make. Innovation. Tenet has a culture of innovation that creates new solutions for the challenges and opportunities in their healthcare system. Service. Tenet has a culture of service that values teamwork and focuses on the needs of others. Integrity. Tenet manages their business with integrity and the highest ethical standards. Last but not least is transparency. Tenet operates with transparency by sharing results and outcomes. Now let's talk about 2 important business strategies I use to analyze Tenet's framework. The first is Miles and Snow. This typology subjectively classifies organizations based on their patterns of strategic decisions into 4 categories: prospector, analyzer, defender, and reactor. The prospector strategy seeks innovation and new opportunities. To implement this strategy, organizations need to encourage creativity and flexibility. In such an environment, creativity is more important than efficiency. The analyzer strategy attempts to maintain their current businesses and to be somewhat innovative in new businesses. Analyzers have tight accounting and financial controls, high flexibility, efficient production and customized products, creativity, and low cost. Defender. This strategy attempts to protect their market from new competitors. Organizations rarely need to make major adjustments in their new technology, structure, or methods of operation. Instead, they concentrate on improving the efficiency of their existing operations. Reactor strategy. Organizations that follow a reactor strategy have no consistent strategy-structure relationship. Reactors are organizations in which top management frequently perceive change and uncertainty occurring in their organizational environments, but are unable to respond effectively. Therefore, failed organizations often are the result of reactor strategies. When analyzing Tenet Healthcare's comprehensive network, Tenet Health falls into the prospector strategy organizational type. Tenet's Health Capital allows a corporation to focus their investments on innovations to improve patient care. According to the CEO of Health Catalyst, funds are focused on primary care access, care coordination and patient engagement, chronic disease management, clinician experience, data analytics, and consumer health and its wellness service. Now let's look at Porter's 5-force model, which consists of bargaining power of suppliers, bargaining power of buyers, competitive rivalry, threat of substitution, and threat of new entry. Bargaining power of suppliers directly affects a corporation's financial status. This power allows vendors and suppliers to sell high-priced or low-quality supplies to their buyers. Vendors and suppliers will have strong bargaining power when there are few to no other supplier and many buyers, few substitutes for supplies, Switching to other supplies is expensive. Suppliers are large and threaten to gain ownership or increase control over its distributors or retailers. Fortunately for Tenet Health, no bargaining power of suppliers exists because of their extensive list of suppliers and partnerships that exist through 47 states. Bargaining power of buyers. When bargaining power is evident, buyers have the power to demand lower prices or higher product quality. Organizations with this power can put forth their power of bargaining when purchasing in large quantities, only few buyers exist, there are bountiful substitutes throughout the market, buyers are sensitive to pricing, and when buyers threaten to gain ownership or increase control over its previous suppliers. After analyzing Tenet Health, it is a fact that they may use their bargaining power when they deem necessary. Tenet has indeed attacked the bargaining power of buyers by building a large base of customers. This reduced the bargaining power of the buyers and provided an opportunity to streamline its services and quality care processes. Threat of substitution. By continuously innovating new products and services, customers can find discounts on established services or products. Therefore, Tenet Health must maintain innovation so it limits the bargaining power of buyers and reduces the defection of existing customers to its competitors. Competitive rivalry. Competition exists throughout any market. This force is the biggest determinant on how profitable and competitive an organization is. If the market industry is competitive, the results will sum up to be low profits due to organizations having to aggressively compete for the market share. Competitive rivalry is intense when customer loyalty is low, growth is low, there are too many competitors, products and services can be easily substituted, and exit barriers are high. Tenet Health indeed has three powerful competitors: Universal Health Services, HCA Healthcare, and Ascension Health. According to Porter's 5 force of competitive rivalry, the number of competitors is not a determinant to be aggressively competitive for the market share. Tenet handles intense rivalry among its competitors by building a sustainable differentiation, collaborating with competitors to increase the market size, and by building scale so that it can compete better. Threat of new entry. This force determines if it's easy to enter an industry. It is important for organizations to create barriers to avert new entrants. Threat of new entrants is high when it is financially feasible for any competitor to enter a market. Existing companies cannot prevent or retaliate. No government regulations. Similar products and services. Low customer loyalty. Switching is easy and does not cost a lot of money to do so. Because of Tenet's powerful capital and investments, barriers have been set in place to avert the threat of new entrants. There is a significant association of service-based advantage on the organizational consequences. Companies gain benefit from services and competitive edge contrast to their rivals. For example, more product elasticity, convenience, delivery speed, consistency, and technological support have verified to achieve relatively better performance. Structural analysis within the industry. Tenet has some critical competitive dimensions within the industry. These dimensions are quality care, adaptability, technology, and experience. Quality care. Consistently high quality care and reliable care is what they strive for in their hospitals, and it starts with standardizing core processes across their organization. Adaptability. Tenet has the capacity for handling structural changes to keep up with their environmental changes. The adaptability the organization is crucial to meet new demands and changes to its functionality, assignments, and activities. Technology and experience. Technology in healthcare is extremely important because healthcare is changing on a day-to-day basis, and therefore hiring physicians and non-physician providers who have experience in population health can meet the organization's quality expectations and meet community needs. There are several critical factors that help Tenet define who they are. Diversification and integration. Tenet Health is a diversified, integrated organization. Tenet provides healthcare through a wide range of services such as acute care hospitals, ambulatory surgery centers, urgent care centers, satellite emergency departments, and diagnostic imaging centers. Their success is attributed to 69 hospitals, 21 USP hospitals, 460 outpatient centers, 32,000 active physicians, and 50 health systems partners throughout 47 states. The success of a healthcare organization depends on the variety of services and healthcare services they provide. Innovation and change. Innovation and forward thinking is crucial for business survival and growth in the current climate of rapid technological advancement and changing consumer preferences. Tenet has implemented value and satisfaction by improving cost efficiency and patient throughput. A Medicare performance initiative consisting of tracking, monitoring, and assisting with healthcare delivery practices ensures innovation sustainability throughout its organization. Transformational leadership. It is crucial to an organization's success to have leadership that benefits the organization as well as the community. Transformational leadership inspires followers by challenging them to take ownership of their work and take a better look at understanding their strengths and weaknesses. This will optimize their work performance and gain work appreciation. Culture of responsibility and accountability. It is imperative for healthcare organizations to improve the quality of the patient experience. Aligning the right provider with the right patient results in the most efficient use of resources, drives waste out of the system, creates capacity for others, and reduces costs. Patient satisfaction is created when the benefits received from the healthcare experience outweigh the monetary and non-monetary burdens endured to receive the care. Aligning the payment model with value. This is encouraged through in the integrated health systems. The law proposed by the Centers of Medicare and Medicaid Services requires payment models that will reward hospitals for working with healthcare providers to avoid complications, prevent hospital readmissions, and speed recovery. This new law provides incentives for physicians to join or to form ACOs and better coordinate patient care. If ACOs provide high quality care and reduce costs, they can keep some of the money that they have helped save. Tenet industry dynamics. These two important points are the reasons why healthcare organizations like Tenet change over time. Rapid technological advancement is happening faster than organizations can keep up with. Telemedicine is becoming a new health system that has the potential to create competitive advantage for healthcare organizations. The economic state of the organization is unpredictable. Low-income Americans continue to be uninsured due to continuously changing healthcare policies that prevent them from being able to afford healthcare insurance. Legal environmental factors. Although many healthcare providers and healthcare organizations strive to deliver quality care and submit error-free claims for payment, some organizations and providers benefit unfairly from taking advantage of government healthcare programs. Insurance fraud is any act committed with the intent to obtain a fraudulent outcome from an insurance process. A kickback is when payments are made with the intent of influencing or gaining something from a company or a person. In 2016, Tenet agreed to retain an independent compliance monitor to address and reduce the risk of any reoccurrence of violations of the anti-kickback statute by any entity owned or in whole or in part by Tenet. Tenet Healthcare Corporation and two of its Atlanta area subsidiaries were dealt criminal charges and criminal claims related to a scheme to defraud the United States and to pay kickbacks in exchange for patient referrals. Under the terms of the non-prosecution agreement, Tenet Healthcare System Medical Incorporated and the Tenet avoided prosecution by fully cooperating with the government's ongoing investigation and enhancing their compliance and ethics programs and internal controls. Tenet Health is one of the many critical sectors for the economy. Tenet's future of healthcare, with its elaborate operations, specialties, networks of regulations, and health policies, will shift its activities from delivering health towards a broader range of approaches. Society needs passionate people equipped with a basic conceptual structure to create meaningful and powerful healthcare innovations that will one day alter the paradigm of the United States as we know it. Those who will go all in may fulfill their vision of changing the world, and in the process, they will realize the best outcome possible, improving the lives of people nationwide.